Timmarie calls this the diagnosis that saved her. Imagine how you'd feel if you found out that your obesity wasn't caused by self-neglect or a lack of willpower, but by a hormonal imbalance. Timmarie had a condition that drove extreme hunger, relentless weight gain, crushing fatigue, uncontrolled diabetes, and recurrent skin infections. Symptoms so severe that just getting out of bed in the morning was a challenge. Hypercortisolism, also known as Cushing syndrome, is a serious and debilitating disease caused by high levels of cortisol, the body's stress hormone. For years, it was considered extremely rare, thought to affect only 1 in a million. But new research tells a very different story. It affects up to 1 in 4 people with difficult to control diabetes. In this episode, Timmarie bravely shares her journey, the symptoms, the fear, the treatment, and the courage it took to face it all. We talk about her transformation and why she says that finally getting this diagnosis saved her. And spoiler alert, she's lost over 100 pounds. Her diabetes is under control, and the symptoms that once ruled her life are gone. This is a story you won't want to miss.
Well, I'm really grateful to be joined here by Timmarie. She is willing to tell her story and actually has a really amazing medical story here. So, Timmarie, thanks for joining me.
Thanks for having me.
Yeah.
I'm excited.
Good. Good.
It's been a journey.
It has been a journey. So we want to tell a story about obesity, but not just obesity, but a secondary cause, an underlying cause of obesity that we found in Timmarie that we are able to treat. And what an amazing transformation and journey. So, spoiler alert, we're just going to tell it right from the beginning what happens so everybody knows where we're going here. So, Timmarie lost over 115 pounds. And
I'm so excited.
she went from diabetes, horribly controlled, out of control, unable to control, to amazingly controlled.
Yeah.
And symptoms that were horrendous and pretty much disabling to going to almost complete resolution. So let's jump into that and see.
Yeah.
So we have a few graphics that we're going to post up here. One of them is your treatment timeline. So back in 2017, your A1C, which is your diabetes marker, was over 15, which is actually off the chart. It doesn't measure above that level.
Yeah, I heard that 15 is the highest, that it could have even probably been higher than that. So
it could have been who knows what.
Yeah.
And you started treatment and actually went pretty well for like 5-6 years, and then landed in the hospital with a skin infection.
Yeah.
And at that time, actually, your A1C had come down, but had jumped back up to 12.7, which is, again, horrendous diabetes control in everybody's opinion. And that's where you hit your peak weight of 332 pounds.
Yeah, 332 pounds. Oof.
And then we started seeing you and were able to find this diagnosis of hypercortisolism. So starting some medications, we started Mounjaro, we started Jardiance, both of those are diabetes medicines.
Yep.
And as soon as we were able to get everything we needed from the cortisol diagnosis, we were able to start you on a medication called Korlym.
Yep.
So
That
so many
journey.
details around that, huh?
Yeah.
And then that was in August of 2024. And since then, we'll show your weight journey here from 332 pounds down to 215 pounds.
Yeah, I never thought it was possible. Never thought it was possible.
A1C has been actually below 5, which we don't usually shoot for that low, but it's doing what it's going to do, and it's not low enough to cause side effects. So we're just doing the treatment, and here you are.
Yeah, and here I am.
With a lot of bumps in the road, huh?
A lot of bumps in the road. It was definitely a journey, but in the long run, it's a great journey that I've been on. I've learned a lot, and I'm excited to share my story to you that are out there, that maybe this might help someone that's going through what I was going through, because I didn't have any hope. You gave me hope.
Oh, thanks. Well, we want to look at what it's really like to go through this.
So before I was diagnosed, I've always dealt with weight issues. I've been thin, I've been heavy, I've been thin, I've been heavy. And my parents always told me that I was blessed with the fat gene. Blessed, I guess. I don't know. But they used to just, that's something that you're always going to have to work on. And I loved food. Food also loved to talk to me and tell me that I needed it all the time. I would diet, and then I would gain the weight back, and I would diet, and I would gain the weight back. And I don't know what it is with going into the grocery store when you're dieting, but you don't smell those smells when you're not dieting. So you smell the bread, you smell the cupcakes, and it's all talking to you. You need me, you need me. So that would be hard when I was trying to diet, because I did love food. It was natural too for when my family and we were out doing an activity, that we would normally stop and grab dinner out. And usually on the way back home, we would always treat ourselves to an ice cream cone or something on the way back. I share these things that I went through because I also want to share where I'm at now and how I don't deal with that food noise or those smells. I was in my mid-40s. And I was on a diet. I had tried all diets. I usually was pretty successful, and I usually could drop the weight pretty fast. But now I'm in my 40s, and this time it was really hard. I could not get the weight to go down. And I thought, I'm going to have to starve myself to keep the weight off or to get it down, because I was working so hard to lose it, and I wasn't losing anything, and so frustrated. And I decided I don't want to starve myself, and I love food. So I decided, you know what? I'm in my mid-40s. I'm fat. I'm going to be fat, and I'm going to enjoy life, and I'm just going to learn to love myself. It was getting harder for me. I've always been someone who loves to go. Get the house cleaned, get, my job done, take my daughter where she needs to go, groceries, bills. That was just what I did every day. And I didn't realize the stress that I felt with that. I just thought that was normal. I thought it was normal to feel that anxiety and stress every day. And so I just learned to live with it. But it started to get really hard because I wasn't able to do some of the things. Now I'm in my mid-40s. I'm probably not at 332 pounds yet, but I'm definitely up there. And it was getting harder to go all the time. I was fatigued. My knees hurt from carrying all the weight that I had gained. And that was hard for me because I was used to going and doing all of those things, and I had to start telling myself that I needed to take breaks, but I wasn't good at listening to myself. I still would go. And so then I would be in pain and exhausted. It wasn't just being exhausted or feeling tired. It was a deep fatigue that I would feel. It wasn't just the weight. My body started to change at that time. I started to develop a buffalo hump on the back of my neck. My face became real round. You'll get to see a picture of what I looked like later. My cheeks were always red. I hate to say this, but I had a lot of facial hair. I remember I had to wax every week to not have anyone see that growing on my face. And my hair was thinning out. When it came to being around friends and photos, I would run away, don't take my picture, because I would end up having to see that picture, and then I had to face the fact that I am fat. What have you done? And disappointed in myself and feeling guilty that I'm the one who's caused me to be so heavy, and beating myself up about it.
And this was after you decided to just accept yourself the way you were.
Yep.
And you still felt that guilt.
Mm-hmm. Absolutely.
Yeah,
I don't know if you ever.
That's really hard.
Yeah. Yeah, I don't know if you ever not. I mean, we live in a world too where we're supposed to look a certain way.
The comparison. Yeah.
Yes.
Yeah.
And I think as women too, we compare ourselves a lot to all kinds of things. Are we the best mom? Are we the best wife? Are we looking good? It's a lot of stigmatism that's put on women. And so when I could feel people looking at me, I was embarrassed that I let myself get that way. Then come to find out, I was diagnosed with Cushing syndrome, which I say is the diagnosis that saved my life.
And to think that you were beating yourself up this whole time.
Yeah.
For your connection to food that's triggered by an internal hormonal abnormality, by your appearance that's caused by a hormonal imbalance.
Yeah, I couldn't help it.
And the fact that you couldn't get your kids around and do the work that you needed to do.
Right.
All because this medical condition was sitting there rearing its ugly head.
Yeah, it was ticking away inside me, and I had no idea what was going on. And that's the part that sucks about not knowing what's going on inside your body, because we can see what's going on the outside. I was obviously getting huge. My belly was huge. My arms and my legs were still thin. I couldn't lose weight. I was tired. I can remember still to this day how tired I felt every day. I thought something has to be wrong, but then I would just blame it on the fact that I was so overweight. That's why I'm so tired. You've done this to yourself. You're so overweight, and that's why you're tired. Your knees hurt. It's because you're overweight, which probably is true for the knees part. But probably the hardest part, too, out of all of that was the mental and hormonal state that I went through. My poor family. I was very irritable. I was very anxious all the time. I would say, and people would probably say it about me too, that I was emotionally unstable. And this is not me. I'm a very happy person and positive, and I like to have fun and do things, and I was crying over the silliest things, but I just could not help my emotions.
I'm glad that you can say that now with a smile on your face. I'm sure it was not something you could smile about earlier.
Yeah, if we did this interview last year, I probably would be crying through this whole thing. So you may see some tears today, but not as bad as I was. But when I would talk about my emotions to my friends and stuff, my daughter would always say, by the way, Maddie, would always say, oh my gosh, you don't know what it is to live with my mother. And I really didn't know that I was that way. It was weird. It was like I was going through it, but I started to think that I must just been going through menopause. So, my period was irregular. I had to wear a pad every day. I still have to wear a pad every day. I've got another procedure coming up that hopefully is going to take care of that situation. And yeah, I would just cry over everything, and I swore it was just had to be menopause. But the changes, I really am strong about my faith, and I really think that God had stepped in to save me and make me see my purpose and to have me finish my purpose on this earth. I was so sick, and I had a skin infection, and I was hospitalized. But God knew of the most amazing doctors that were out there that could save me. I didn't like to go to doctors, so I wasn't really excited about going to doctors, so I really didn't go a lot. I did go to my my diabetes doctor, obviously, because diabetes is something important I needed to take care of. But I just was not a fan of going to the doctors. And so God had to give me this infection to get me into the hospital because he knew what was going on, and I didn't. And that's when I met Dr. McElkey, my OBGYN, who I love. He saved my life. He introduced me to Dr. Moretti. He said, "Oh, you have to go see this internal medicine doctor. You have to see a doctor." And I was like, "I don't have a doctor." And he was so wonderful, because when I was in the hospital and I left the hospital, you're just kind of given your paperwork and sent on your way with no after plan. And Dr. McElkey was so kind that he knew that I needed more care. And so he said, "I want you to see Dr. Moretti." Especially because of all the other issues that I was having, with the crying all the time and, just feeling menopausal. So, and he did my lab work, and I was not even premenopausal. So obviously there was something else going on, and that's why he wanted me to see a doctor.
Can I ask you a little bit more about what it was like, and maybe actually a few more symptoms before you got the diagnosis? I mean, on our graphic, I think we have the brain fog.
Oh, yeah.
Memory problems.
Oh, yeah.
Sleeping problems. Insomnia
yeah.
is really common in all of those,
Yeah.
all of our
I
patients
did not
who
sleep
have
much, so then I would want to sleep during the day.
anxiety. You already mentioned.
Yes.
Mood instability. That's
yes.
really common. Skin infections.
Yes.
That's actually common.
Yeah, I would get sick over anything.
Yeah.
I would just, all of a sudden, I would be sick. And it's because my immune system just was not working.
Yeah, it suppresses the immune system. Mm-hmm. Kidney problems.
Oh, yeah.
We had that. Fluid retention, swelling.
Oh, yes. Still struggling with that.
All over the place. Yep. And that'll still get better over time. High blood pressure.
Oh, yeah. I've had that for a long time.
Diabetes is a huge factor here. I know so many people who have diabetes from this, and huge. And poor sugar. We already talked about how high your sugars were, like 300-400 all the time.
Yeah.
And then the uterine bleeding stuff is actually really common too.
Yes.
And then all of these
That's probably the one thing that it sucks the most.
Yes.
It's the uterine bleeding.
Yes. And then all of the GI issues that are related to it. You can have, you had the symptoms that I noted for you were constipation, abdominal pain, bloating, nausea, and even gallbladder problems.
Yep.
That's a huge list of symptoms.
Yeah. And here I didn't think that I needed to see the doctor.
Right.
Who knows?
What did it feel like to have all those symptoms and not realize that it was caused by something?
I think I just got used to having the symptoms. I don't know that. And I was so stubborn on not seeing a doctor that it was always something that I could fix. I'll look this up online, and if I drink this, then that'll help it. Or if I eat this, or if I take that, it'll help it. But nothing was helping. I really think, Dr. Moretti, that I was a ticking time bomb. I really think that my body was so out of whack inside and so sick that it was just a matter of time that I was going to have a stroke or a heart attack or just die.
And actually, medical studies prove that heart attacks and strokes are much more common in people, obviously with diabetes, but with hypercortisolism, Cushing syndrome as well.
Yes.
Yeah. I just had a realization while you were talking earlier, having a disease and not realizing that there's a disease, like you were saying, it was very stigmatizing. I feel like it's too easy or just very easy to blame yourself for all of the symptoms when you don't realize that there's something else causing this.
Yeah. Yeah, for sure. Who would have known? I definitely wish I would have saw you much earlier on in life. I probably wouldn't have a lot of the health issues that I'm still going to deal with the rest of my life because my diabetes and blood pressure was so out of control for so long. 2017 was my first appointment with my endocrinologist, but I'm sure because of me being stubborn and not wanting to see a doctor, I'm sure it was much earlier than then.
Well, if your A1C was off the chart, you never know how long it's been going on, but it was bad.
Right. Yeah, they were, I remember putting them in a panic. Oh my gosh, you must have cancer and, stuff like that. And oh my gosh, and I would blame myself though, of course, because I'm the one putting the food in my mouth. But I think I loved food because it brought me happiness. So when I did start the medication, and I'll go back to some of that in a bit, when I started that and I started to get in a better place where I didn't love food like I used to love food, that brought me happiness because of my stress. My body is producing too much stress hormone, and I'm working a job that was very stressful. So what gave me happiness at the end of the day was food. And now I'm in a place where food is not my love anymore. And that was challenging for me to go through that too. Because what do I do now?
That's an interesting conversation. We've actually had that same conversation with other patients. Lauren, in her podcast with me earlier, when she was on the show, talked about that withdrawal of sorts emotionally from having that crutch or that turning, that something to turn to. And the food noise goes away, and then what do you fill your time with?
Right.
What do you do with your thoughts that aren't occupied anymore by food?
Yeah. And when you do that for so many years, it was depressing for a little while because I didn't want, and I think Mangiano was a help in that too. I didn't want the fast food. I didn't want the sweets anymore. That was huge for me because that was my downfall, was sweets for sure. I didn't think about sweets anymore. I didn't have that food noise in my brain tempting me and talking to me that I needed. But now what do? I have so much in common with my husband. When we would go out to eat, that was our thing to do, was to eat. We both loved food. And now what? I am going to get into that as far as what I did do, what I did find that I loved. but I did want to go back to when I first came to visit your office.
So yeah, let's talk about what it's like to get the diagnosis.
Yeah. So my skin infection had healed. And so I was now going to see Dr. Moretti, but he, of course, was booked because he's very busy. So I saw Chantel, who I love so much. She's the first doctor that I ever met that made me feel safe. She was like just my buddy. What can we do? You're in a health crisis. We have got to get this fixed. She cared about me. She told me we're going to be besties for a while until you get your health under control. She was so compassionate and so kind. And still to this day, I'm not stubborn about going to the doctor. I enjoy coming to see Chantel. She's just such an amazing, wonderful lady. And as she was treating me and doing the labs and all that stuff, because your practice is a team, she said to me, I'm going to talk with Dr. Moretti at the end of the day, and we're going to discuss your health. And I was like, wow, I have a team of people now? And that's when you decided to test me for Cushing syndrome. And to be honest, when he wanted to test me for Cushing syndrome, he gave me a pamphlet, and said, you need to do this, and then we'll test you. And I honestly threw the pamphlet away. I really didn't think I had it. I was like, yeah, okay, whatever. I never have anything, even though my body was so sick. But I was so in denial that I was sick. And so I threw the pamphlet away, did the labs, meet with him again, and guess what? I have Cushing syndrome. But again, that diagnosis saved my life.
What did it feel like to get hit with that? I was glad to hear it wasn't me. I mean, I'm sure I had a part in it too, but I'm glad it wasn't me. It was what was happening inside of me, and I was scared at the same time. I didn't even ever hear about Cushing syndrome. What is Cushing syndrome? I mean, he gave me a pamphlet. I threw it in the garbage. So I then definitely got online and I started reading, and I thought, oh my gosh, this is me. These are all the symptoms that I've been dealing with for years and years and years. The foggy brain, the being overweight due to stress, feeling panicked and stressed all the time, which I just thought was just so normal, just to feel it. That was just how I felt. Was it a shock or a relief, or was it something different? Like, how does it hit you when you get that?
I think it was a little bit of both. Because I threw the pamphlet away. I really didn't think I had it, so I definitely was shocked.
All right. So the diagnosis, it hit you, but then it kind of didn't hit you until you looked at all the symptoms. And once you realized that these were all your symptoms, what did you think then?
I was just like, wow, what's next? What's next? What does this mean for me? It was a long journey.
Yeah, it is for everybody.
Yeah, it's not an easy journey. Even just getting the medication alone was tough because my insurance did not want to pay for it. And so that took months for them to finally decide they weren't paying for it. And then for some reason, I think you maybe just gave me the phone number for Spark, and I just happened to call, and They're like, do this, do that. And I ended up getting the medicine at a very low cost. Also with the Spark program, what's amazing about the Spark program is that I was given an advocate. Her name is Lindsay. She was fantastic. She gave me a lot of hope. She told me I wanted the truth. What am I going to go through? I would hear little things here and there, and I would read things here and there. But what am I really going to go through when I start this medicine, Korlym, to help my Cushing syndrome? And she was honest with me. And I was scared to death. I thought, I don't think I can do this. Maybe it's just easier being fat. But I knew my road with my health at that point was going to end soon. And I have a family. And I have a mom who I love. And I have besties. And I want to be around for all of that stuff. And so she was honest with me. And she helped me come up with a plan. And that's when we decided I definitely needed to take some time off of work for my stressful job. And that was hard for me too, because I'm such a hard worker and I'm so devoted to my job. And I have been for so long. That's just who I am. That's just what I was used to doing. And here I'm having to take care of myself. I'm sick. What if I don't take care of myself? I had to learn to have patience for myself. I had patience for everyone. I'm a very patient person. I deal with calls, all day. I'm very patient. I'm very helpful. But I wasn't being very patient with myself. That was hard to learn. I have learned it. And I do prioritize myself now. My health is the most important to me. If I can't be healthy, then I can't be healthy for anybody. I had to learn to give myself grace. That was hard. We beat up ourselves so much. But yet we give everybody else grace, patience, love, kindness. And I couldn't even give it to myself. It was a huge wake-up call for me. There were times when I was going through my journey and I'll list all the side effects and what I experienced.
Let me just say that
Yes.
even being willing to go through this treatment, knowing that it could have a lot of side effects before you get better, that takes a lot of courage.
Yeah, and I think you would say that to me too. And that's always what kept me going. Okay, he knows what he's talking about. I mean, here I'm with a doctor that specializes in Cushing syndrome. God had a plan. He knew I needed to see you because he knew you specialized in it, and I wasn't going to get the runaround with any more doctors, and I was going to get better, and I was going to serve my purpose in life.
What an amazing story.
When I first started taking Korlym,
So what does it feel like to start treatment?
so once I was able to get the Korlym, Dr. Moretti did come up with a plan for me, which I was very grateful for. I think we started off with one pill every 3 days. Mm-hmm. I still went through the side effects, but it would have been so much worse if I was taking that pill every day. I remember telling you the next day, I took it the next day, I felt like I was having a miscarriage. My body went through this emotion of depression and that I was having a miscarriage. And I knew I wasn't because I knew I wasn't pregnant. I mean, I'm 51. There's no way. And I remember being in the laundry room and going, is this my new normal? I'm not sure I want to be depressed all the time. And a couple days later, it went away. I still went through the side effects of, let me just pull them up real quick. I wanted to make sure I got them all because it has been a while.
And there's a lot of them, actually.
Yeah, there's a lot of them.
Isn't it amazing that medicine that is given for the right person, for the right purpose, in the right way, still can be really difficult to handle?
Yeah, because, going into it at first, I just thought, I'll just take a pill and I'll be great the next day. It's been a year and a half. It's been a year and a half. It's been a year exactly this week that I started taking the Korlym. A year. And I look back and I think, oh my gosh, where my body was and what the medicine did to me. and wanting to keep going. I think you always gave me that encouragement too. Like, you'd say this, and this, and this. And, I know that my positive attitude had a lot to do with it too. Mm-hmm. I wasn't positive every day. I mean, there were days that were dark because I just couldn't take it anymore. I think as humans, we can only take so much sometimes. But I refused to give up on myself. And I was going to figure it out and try it. Why not give it a chance? What if? And I can't seem to find my notes with the...
This disease is so intertwined with emotions, and treating it is also an emotional process too.
Yeah.
Isn't it?
Yeah, because like I said, I thought, I'll just take a pill and I'll be fine, even though I read the side effects.
Yeah.
But yes, I was dizzy. I had nausea. I was vomiting. I would fall because I was dizzy, so I was unbalanced. I'm trying to think of some of the other ones. It's been so long since I've had a lot of those.
If you want to break and find it, that's okay. You might as well. You went through the trouble of writing it up.
So again, you had come up with a plan to make those side effects a little bit easier on me. But I still had to endure lots of side effects like nausea, vomiting, fatigue, depression, headaches, dizziness, and I didn't have to deal with those before. Because I had taken some time off of work, I was very grateful that Lindsay and I had talked about that, because I learned to just try to sleep through it. So the first 3 months, I did a lot of sleeping. And I remember bringing that up to you one time, and you said, and also because your body has been so stressed out for so long, you're giving it medicine, and it's tired. Your body's tired.
And sleep deprived.
So
you take that stress hormone away, and the insomnia goes away, and you have to catch up on sleep for...
Yes.
It's typical
months.
For our patients. That's a long time. 2 or 3 weeks is kind of typical for going through having to sleep an extra couple hours a night or something.
Yeah.
Your circumstance was extreme.
Yes.
That's pretty hard.
But I remember 3 months into it going, oh my gosh, I don't feel that stress that I used to feel. I just felt calm. I felt peace. Even when I did start to feel better and I would start to do the normal things that I was doing before, I still wasn't feeling that anxiety. So I knew my body had to be out of control for a long time with high stress hormones in my body.
So I should clarify too, since your symptoms were actually so bad from treatment, that's not typical. Most people don't have as many symptoms. You had it bad.
Yeah. And I think I had it bad because I had it for so long.
Probably.
And so untreated.
Mm-hmm. And my goal is to not let people go through those symptoms as much as you did.
Yeah, because I remember you would say that some doctors, they don't know how to do it that way, and that they would just prescribe it to be every day. I was so grateful that you knew what you were doing.
Well, I have to say the typical routine is to give it every day to start with. And so, you have to take it individual per patient about what the response is going to be and try to make a good decision on how it's going to be best accepted by you too.
Yeah, and I even think at one time we upped it, and then we ended up having to go back one time too.
Yep.
So,
and this is why it takes so long to really kick in and
right.
and really get better, because it takes a year or more for your body to reset the system.
Yeah. And I feel like I'm almost there. I mean, I had to go through, not just the side effects, but I've had to have, several procedures. I've had to have a few surgeries. I'm going to have a few more, not because of the Cushing syndrome, but because of what my body had went through. Well, and then with the Korlym causing the uterine lining to thicken, which does make my periods very heavy. And we've tried so many different things to get that to stop, but we're going to have to do the big one to get it to go away. And I know when I do have that procedure, I know that my life is going to be a whole different one than it's ever been. And I'm really looking forward to those adventures.
This really highlights the difficulty that it goes through to get better.
Yes.
I mean, it's supposed to be like a snap of a finger, everything's better, right?
Right. No, it wasn't.
But with this disease, it's actually, sometimes it causes problems because of the treatment, and uterine bleeding is one of the side effects of Korlym.
And you always told me that too, but I was like,
So sometimes we have to stop treatment too. I mean,
right.
We don't push people past the limit, so.
Yeah, you would tell me that too. And I'm like, nope, I am not stopping this Korlym. I've been through it already. I don't want to start over again.
Yeah. Let's
just get through it. I had the time off of work, so I was able to just get through it.
Well, and luckily you have a good gynecologist who can advise us on how to manage that.
Yeah,
because that's complicated.
You and Dr. Meckelkey would have conversations over the phone about my care because he wasn't real familiar with Cushing syndrome. So he wasn't quite sure what to do with me. And so I was so grateful that they knew each other and that they would talk about my care and what would be the best for me. I did want to go into a couple of things about when I was talking about the food noise stopping and not sure what to do with myself. I have an amazing friend that introduced me to water aerobics, and I fell in love with water aerobics. It sucks a little now because the pools are too cold, but I started with just walking in the pool, and then I started going, you know what, I can do more. Let's do it. I was finding a love in something else than food. And so I would take my tablet down to the community pool, and I would put on YouTube, Coach Stacy. She's the best. She has such amazing videos out there for all ages, all body types, and you can pick what you want to do. And that gave me such a love for life. Like, I love this. I tried doing the gym once the pool got cold. Not so successful. Gym's just not my thing. The treadmill's just not my thing. But I think, too, with being older and of being so overweight, the water is just easier to exercise in than on a treadmill.
With knee pain, definitely, yeah. Or people who have back pain or hip pain or ankle pain or anything that's weight related.
Yeah, so I'm looking forward to as soon as March. It'll still be a little cold in March, but I'll push through. So, or I just need to find someone who has a heated pool. Again, I still have some health issues because my body was so sick for so long. I found out that I do have stage 3B kidney disease, and I'm doing lots of tests on my heart. I've had many surgeries and procedures, still have a few more to go. But I look back at where I was a year and a half ago, and I can do it.
That's so cool. I was going to ask you what it feels like now to be normal.
You know, I remember...
Or to achieve your normal.
Yeah. I remember when I was 332 pounds that was impossible to get out of 332 pounds. Impossible. And then next thing you know, I was at 300 pounds. And then I was at 290. And then I was at 250. And then I was at 230. And there were times that my body would go back up a little bit, especially when I'm holding on to fluid. But right as today, a year today that I started Korlym, I am at 215 pounds. And I thought that was impossible. And you gave me that hope. And you put me on the right medication. It was hard going from not being on a lot of medication. Oh, and also a big celebration. I'm not on insulin anymore. I haven't been for probably 6 months, maybe longer. I'm not on insulin anymore. I'm not on any diabetic medicine anymore. I still am on my blood pressure medicine and the Mounjaro and a few others.
Mounjaro is a diabetes medicine, so
Yeah.
you have to count that.
I was grateful too that you, okay.
Sorry.
But I was grateful though that you knew of Mounjaro because a lot of people are stuck on a different brand. And you said, no, this is what will help your diabetes. And immediately when I started taking Mounjaro, I started losing weight and my whole attitude to food changed. All I craved was rotisserie chicken and green beans. If they wanted to go to a fast food restaurant, I would almost want to just throw up in my mouth because that just made me feel so sick to eat that food again. And I never thought that was possible. Never. I always hoped for a miracle drug. Didn't think it was ever possible, but I'm definitely living proof that Mounjaro helped me with my weight loss. The Korlym has helped me extremely with Cushing syndrome. It was a long journey. Was it worth it? Absolutely. There were times that I didn't think it was.
And you're still on it.
And I'm still on it. Yep. I will be on Korlym my rest of my life. And that's okay because I don't want to go back to feeling that stress that I used to feel. I like having peace and calmness in my heart, in my body.
I should point out that since you don't have an identifiable source that we found,
Right.
there's nothing to surgically remove.
Right.
And so, yeah, you have the high cortisol. It's coming from somewhere. We don't have the technology to find it. And so we use the medication long term.
Yeah.
And the diabetes treatment, Mounjaro, is meant to be long term initial treatment, bringing things down and then maintaining once you go to maintain your diabetes control.
Yeah.
It's
yeah,
hard.
I want to lose 30 more pounds, you know?
Yeah. I mean,
maybe more. I don't know.
Who knows where you can go?
Yeah.
I should point out that this is amazing. 117 pounds is 35% body weight loss. That's a lot of weight.
That's almost half of me.
Yeah. The average, not taking Cushing syndrome into account, but in people with diabetes, the average weight loss with Mounjaro is really only like 12 or 13%.
Really?
I mean, you've tripled that.
Yeah.
But the fact that you've done a ton of hard work here and found an underlying condition for the diabetes, makes it even that more effective.
Yeah.
But it really is a team effort.
Oh, absolutely. I know that if I hadn't been put in the hospital and met Dr. Muckelkey and then met you, I would probably be 332 pounds, if not larger, and I might not even be here.
It's actually scary to think about what diabetes and cortisol can do to the body when left unchecked.
Yes. So if anyone out there that is listening to my story, if you have any of the symptoms that I had, it is possible to get help. Don't be stubborn like me and not go to the doctor. If you live in Mesa, Arizona, or if you live anywhere in Arizona, Dr. Moretti is here. You've got several locations. I was very grateful for the team that I had. I'm grateful for the doctors that I saw. I'm grateful for my Heavenly Father. It's just so great to be where I'm at now. I like myself. I look in the mirror at myself and I'm like, ooh. Before I didn't really give up on myself, but now I'm like, oh, I like this makeup. I like this dress. Where none of that stuff was important to me because it didn't look good on me. So again, I'm so grateful for everything that you did for me. I say see Dr. Moretti if you want to be tested. Even if you don't think that you have some of the symptoms that I have and that you may not have Cushing syndrome, he's still a great doctor to come see to help with your obesity and diabetes. He's a one-stop stop. Diabetes, I didn't have to see my endocrinologist anymore. I went to Dr. Moretti and Chantel for everything.
And we have the dietitian.
Yes.
And we have lifestyle counseling and physical therapy.
They have it all.
and mental health now for people
Yes.
who, it would have been helpful for you at that time.
Absolutely, because I know that there were times that it was so much. And I thought, I can't do this anymore. But I'm glad where I am now.
But for those people who are elsewhere or have an established physician, every physician knows that this disease exists. You can talk to your physician or whoever your healthcare provider is and bring up the possibility of hypercortisolism,
Yeah.
Cushing syndrome.
Yeah, and
It's
when I
testable.
see people on the road
Yeah.
that looked like me, you have to
Makes you just want to yell out the car window and say, hey, you should
get tested for Cushing syndrome.
maybe a little bit awkward to do that.
But I want to help. I want to help those that are going through what I was going through. I was alone. I had a team and I had an advocate through Spark, but I didn't really have anyone that I knew that had a story like what I have. And so I'm just hoping my story, my journey, helps someone out there.
It's a challenge to have the disease. It's a challenge to find the diagnosis. It's a challenge to go through treatment. The whole thing is a challenge. Just so everybody knows, the initial test is called a Dexamethasone Suppression test. So you take a little pill at 11 p.m. or midnight the night before and do your blood draw in the morning.
Yeah,
and
pretty easy.
It's very precise in terms of the timing. But getting those levels actually will tell us exactly what's going on with the cortisol system.
Yeah. And like you said, it will be a medicine I will be on for my life because that will never, you should maybe use your medical terminology, what the medicine does for the cortisol in my body.
Yeah, it actually doesn't block the cortisol, it blocks the receptor.
Right.
And so your cortisol level still maintains in your body, it just doesn't hook on to anything in your system.
Yeah.
And It's really crazy to see how much effect it has on people. They are coming out with a new one that actually blocks the cortisol.
Oh.
And so it'll work differently when new technology comes out. So we'll get to that when we have an option to see it with that new medicine. And of course, if you have an adrenal nodule, a specialized surgeon can go in and surgically remove that.
Yeah, I remember going through all the tests. So many tests and so much waiting. And being nervous during that time. I was waiting. What if? And then what? Then what? I was lucky when it came to that part of it for sure. But the testing is the big part of it.
It is, and you have to have everything in place before you start the medicine, because this treatment is a big deal. Like you went through, the symptoms are not worth it if you don't have everything established that this is the right treatment for you.
Yes.
And then interestingly, the most rare cause is in the pituitary gland forming a little nodule there. And that's a tiny little brain tissue that makes a signaling hormone. And there is actually surgery available for that too, but you can imagine brain surgery is much more involved.
I was nervous about that one. I was glad
so
I didn't have to go through it.
There's so many things to think about. You need to see somebody who's specialized in this area so that you can figure out what the right direction is for treatment. But almost any doctor can either do the initial test or refer off to a specialist to do the testing. I think the message
it's an easy
is
test.
Yeah,
it's
the message is that you should do the testing if you have symptoms related.
Absolutely.
So your courage is amazing.
Thank you.
And your story is just heartbreaking for years and just heartwarming for how it's turned out.
Yeah, and hopefully it's hope for others out there that have gone through what I've gone through. Because again, I never, ever thought it was possible. But my diagnosis saved my life. Thank you, Dr. Moretti.
Yeah, thank you for making my practice worthwhile.
Well, thanks for watching this podcast episode. Timmarie's story really was inspiring. I made some handouts to graphically illustrate what Cushing syndrome looks like as an underlying cause for obesity. So check this out in the links in the description and download those documents. You can learn more about it yourself and figure out if you might need to get tested based on any conditions that you might have.